The reason people are getting older faster these days is because of the environmental toxicity. I don't think it's their fault that they're eating all this bad food or the fast foods and, not drinking clean water and being under a lot of stress. But I think it's a lot of environmental toxicity that is causing lots of our human ailments and diseases.
Welcome to the Healing Reset, a podcast where we aim to provide hope and true healing from chronic suffering by talking to experts about how to treat your whole body system, not just your individualized system. You guys, contrary to today's belief, your body is designed to heal. I'm Jess, your host. Today we have on Dr. Mathur from Angel Longevity Medical Center. She's a board-certified physician who has become an expert in the growing field of functional medicine. Her continued education and clinical experience has created wonderful results with patients suffering from multiple chronic conditions, but today we're really going to focus on chronic fatigue syndrome. I was reading up, the Mayo Clinic actually defines chronic fatigue syndrome, sometimes known as CFS, as a complicated disorder characterized by extreme fatigue that lasts for at least 6 months and that can't be fully explained by underlying medical conditions. The fatigue worsens with physical or mental activity, but does not improve with rest. So if this sounds like something that you are suffering with or you know someone suffering, listen up and share this episode. Thank you, Dr. Mathur, for being with us, and welcome to the Healing Reset podcast.
Thank you very much for having me here today.
Yes, we kick off this show by just getting a little bit of your background. So for most physicians in the integrative space, there was one defining moment that they said, I'm done with conventional medicine. I want to treat the human body different. Did you have one of those moments?
Oh, for sure. For sure, Jessica. My story is a little unusual. But to give you a little bit of background and my backstory, I grew up in New Delhi. And I don't know if you know, but Indian parents want their child to either become an engineer or a doctor. So I became a doctor, trained in Western medicine. But sadly enough, after practicing for a few years, I realized this is not getting me the results that I wanted to see. My patients weren't getting better, any healthier, or they weren't getting their vitality back or getting rid of the conditions like diabetes, hypertension, or arthritis. And they weren't raving about the outcomes of their treatments either. So I realized that I wasn't really helping people. And the basic reason why I actually became a doctor was to help people. And just you wouldn't believe how even I got to a point where I started considering changing my profession for good, like becoming a real estate agent, believe it or not. And you can laugh about it. But then I got into a personal medical situation where I was myself chronically fatigued. And in spite of all standard testing and assessing and diagnosis, nothing was found that was wrong. So I decided to investigate other modalities of treatments. And so one day I decided, okay, enough was enough. I wanted to change something. So just a couple of days after that, I got this invitation. And that invitation was an email to attend an anti-aging hormone conference in Beverly Hills. I'm based in Southern California. So I was intrigued and I was curious. So I went. And it was definitely fortuitous and God sent. What really blew my mind was not only the speaker, who was Dr. Thierry Hertog, a well-known anti-aging doctor from Belgium, but the entire room full of doctors was super excited and animated about what they were learning. I had attended many CME conferences before, but never seen this many doctors excited about learning something. So it was at that moment that I decided, okay, I'm going to pursue this alternative and holistic approach to medicine further. And it was a good example for me to follow. And then the rest is just history.
So were you able to instantly apply that to yourself in your healing journey?
Yeah, actually, it was very interesting because I learned, Dr. Hertog, I spoke with Dr. Hertog after the event and I said, how many hormones are you taking? So he told me he's taking 8 hormones and I was blown away. I'm like, wow. So I tested myself right away and I figured out what was wrong with me. And I started taking my first hormone and I felt immediate change. Like the next day, I was like a new person. And I said, what is this? This is ridiculous. It's not supposed to happen like this. And it was hard to believe, but I said, maybe it's just one day. And as I kept, working with myself, and obviously over the years, I introduced many, many different modalities into my office and my practice. And every time I actually introduced something, I always would check it on myself first. I would experience it myself, whether it was an IV treatment or a supplement or a hormone. I would test it on myself. So it took me maybe about a year and a half to get back to where I was before. Before I got like this chronic fatigue, which wasn't going away, and I wasn't sleeping well, and it was just a lot of things that were happening. So I realized that it's really good stuff. I should stick with it, and I learned more and more as the years went by. Now I've been doing this for almost 15 years.
I was going to say, was there ever a time where you thought, nope, this isn't for me, I'm going to go back to conventional medicine?
Of course not.
Yeah.
That moment has never happened. I mean, over the years, I've treated, I don't know, thousands of patients. And every time a new patient walks in, I look at it as a new project for me.
Yeah.
The reason is because every person is very unique. So I never treat the same patient the same as the other one. So there is no one size fits all. So it's always like exciting, in other words.
Yeah.
Because it's never the same old same, nothing like that. It's like, wow, this person has their own lifestyle, their own environment, their own nutrition that they're feeding themselves, or their own stress levels. Everybody is so different and unique.
Which is so cool to the human, right? Our fingerprints are different. We are.
Yes,
so
exactly.
One size fits all medicine doesn't always fit. And that's something we try to get across in this podcast of, we're looking at your individual body as a system. How do we heal it? How do we bring it back into balance? How do we limit the toxic burden? It sounds like for you, chronic fatigue syndrome then is a personal, right? Like it's close to your heart, as that kind of launched you into what you do now.
Oh, absolutely. Absolutely. With that, yeah, basically two things that occurred was, first, I observed that what I was doing, even though the patients always liked me because of my personality, but they weren't coming back raving about the treatments that I was giving them, right? And then the other was when I came up with my own personal situation and I couldn't find any answers in the mainstream medicine, I said, okay, I got to really look elsewhere.
Yeah.
And fortuitously, I got invited just the next day. And I was like, what is this? This is a brand new idea.
Yeah.
And, because in the medical school, I mean, you obviously know the basic anatomy and the basic physiology and the basic biochemistry, right? But nobody taught us in medical school anything about nutrition or anything about hormones, that you need hormones as you get older, nothing like that, or any kind of immune boosting treatments they could do, or even herbal treatments. None of that was taught. So I had to teach myself throughout the years. With every new patient, it was like a challenge. So I would say, okay, let's get on with it. And I obviously have some kind of a protocol that I have developed over, period of time that I use, and then between those two things, it works very well.
Now, with chronic fatigue syndrome, I actually was reading up on it and I found this super interesting and intuitive. So I want to get your opinions on this statement. Our bodies can only generate so much energy a day. If we spend more than that amount of energy, then we die. Why? Because our heart runs out of energy, our brain runs out of energy, and our internal organs run out of energy. So the brain can't allow us to spend more energy than we can generate. In order to stop us from spending more than we can generate, it gives us some nasty symptoms like fatigue, muscle pain, foggy brain, procrastination, feelings of anxiety, feelings of depression. So chronic fatigue syndrome is all about energy generation mechanism and then how we spend that energy. The symptoms that are presented, which are probably different individual to individual, mark the gap between those two. Is that consistent with what you see in your practice and how you would actually assess overall chronic fatigue syndrome?
Yeah, because there's two things at work, right? One is that there is a fatigue. The body is not able to create the energy that it's supposed to create, right? And the other is there is an aging process occurring. So depending on where you are on this gradient scale, there could be two different factors. So what I've found that broadly that I can divide these patients into the basic etiology or basic causes of why this is happening is, believe it or not, very, very common is food sensitivities. so common that I just blew my mind when I started testing people, and I said, okay, let me find out what it comes back with. Well, the way I had to do was that two things happened. One is that I had to find the correct labs, right? Because there is lots of labs offering lots of tests in the alternative medicine space. So I wasn't really in the beginning. I didn't know how to interpret these results or what are, which is the best lab for what. So finally, over the years, I figured out, okay, this lab is really, really good at this particular test. So for food sensitivities, we use a blood test. And basically what it tests is not just the immediate hypersensitivity mediated by IgEs, but it's actually a delayed cell type of hypersensitivity. It takes anywhere between 3 to 4 days for you to notice what you are responding to or what you are allergic to or what you are sensitive to. So people don't really find out what they are allergic to or what they're sensitive to because it's not immediate. You're not breaking out into hives right away, or you're not going into anaphylaxis right away. So
Yeah.
testing people for these, it's really, really, really important because, I mean, I've seen people just taking patients like who are sensitive to gluten. It just shows up on the blood test, even though they don't have any other symptoms. That would say, okay, they have some kind of a problem. There's no celiac disease particularly, but they are sensitive to gluten. So, and I take them off the gluten, and immediately they notice a change. They feel better. They have more energy. They can sleep better. It's amazing. Because here's the thing: there is only the way I look at body is that it is basically made up of different biological systems. So, if the systems are working, in harmony with each other, then there is no problem. The body produces. It's not all about mitochondria. I know there's a lot of talk about mitochondria, right? About the energy production, but the mitochondria are affected by various different biological systems. So if your gastrointestinal system is not up to par and it's not really digesting or assimilating or using up your nutrients that you're bringing in for the diet, then nothing you can do that will change the energy production. So unless you change your food, which should be actually the other part of this is like, what is the right diet for you? Right? Because a lot of people don't know what to eat, and they think, oh, some diet is really a fad in the media, and they just pick up on it. Everybody wants to do keto diet, but I'll tell you, I've done keto diet, didn't work for me. So everybody is different. Some people need plant-based diet, some people need ketogenic diet, some people need high protein diet. Everybody is different. So my basic foundation is I attribute every person to be very different than the next person. So we check different things.
Let's back up a second because I want to get into that's very consistent with what I read about how your gut, that takes up a lot of energy, right? So if something's misaligned or you're not getting the proper nutrients or your body's disagreeing with the nutrients you're putting in, it's taking up a lot of your energy, which means you can't have the energy output, I would assume, creating some fatigue. But for you, a patient comes in, I want to start at that journey. They walk into your door. Are you their first doctor? Or in my mind, they've gone through years of misdiagnosis or years of being told, hey, sweetheart, that's in your head. You're fine. Or you're busy with a bunch of kids. You're just in a season of life where you're meant to be tired. Or you're depressed. Let me put you on an antidepressant. So really talk to us about when a patient first comes to you, where have they been? Or are they a new patient who you just get to kind of clean slate work with from that point?
No, those patients are hard to come by that are the clean slate. Most common on an average, my patient that comes to see me has seen at least between 5 and 10 different doctors.
Jeez, that's a lot of doctors, which probably equates to a couple of years minimal.
That's right. So usually the patients come in with chronic fatigue syndrome. They have been fatigued for at least a year, and more commonly is between 10 and 20 years.
Wow.
Yeah, so they have been seeing a lot of different specialists. I mean, amazing. They go through one doctor to the next. And in fact, I even see patients that have seen other alternative physicians. So they have seen, chiropractors, nutritionists, or acupuncturists, or other functional medicine doctors. and they just, they don't do well, or they didn't get where they needed to get. They got better, but not fully. So they're not fully happy with the results. And I mean, it's amazing.
I've heard of doctors that if they see the chief complaint being fatigue, they won't even treat, they won't see that patient.
Really?
Because it's a very common complaint and it's hard to really narrow down what it is. And then you look at a diagnosis like chronic fatigue syndrome, it feels kind of broad when you're looking at the symptoms or how to get to the root cause. Like we like to do on the Healing Reset, talk about the root cause. It's hard to really figure that out. Well, if you're not in alternative medicine or integrative medicine and not looking at the body through that lens. So what triggers you to this diagnosis?
Well, it's so the way the patient presents, right? Usually the patient not just has one thing that, if you have fatigue, let's say if you have fatigue, so that means that the body is not able to generate energy. So what that means translates into different systems. So if you have, let's say, musculoskeletal system, so you don't have energy, so then you won't really have energy to walk or to do the activities you like to do. Some are in the sports, some kind of particular sports they like to do, but now they tell me, oh, they can't even run or they can't even do their daily chores. Some of the homemakers or housewives, they tell me, oh, I can't even do my dishes anymore. So obviously it's like that's very non-optimum condition of your life. So my idea as a doctor is to get you to a condition where you are able to do what you like to do in your life and be able to achieve your dreams, whatever those are. Whether you are a movie star or you're a musician or you're a baseball player or you're a guitarist or whatever your profession is, or you're real estate agents, whatever you do, you want to be able to do that. So my job as a functional medicine doctor is to find out what's the underlying cause, how I can bring the body into harmony. So that way the body can work with each other, all the systems can work with each other. And then you can get the best harmony and the best energy is going to be produced because you not only are providing the nutrients like you mentioned, but there is also no toxicity. There is also no viral replication going on in the body. The most common cause for chronic fatigue is Epstein Barr Virus, which I find 99% of the time in patients that are coming with a major complaint of fatigue.
Is that an easy test to run?
Yes, it's a very, very easy test to run. Actually, the funny thing about it is that now in LA, I've been seeing a lot of patients for a long time. So my patients come from, major universities, like they come from USC or UCLA or Cedars-Sinai or whatever. And I see that those patients are actually being tested in those facilities for Epstein Barr Virus. So I'm kind of impressed. I'm like, wow, this is awesome. They already checked you for it. But unfortunately, they don't know what to do with it. Yeah. So they can do the testing, but they don't know what to do about it. I mean, things are changing. Believe me, when I started functional medicine 15, 17 years ago, nobody knew even the word antioxidant. And now you see the billboards with the big signs of antioxidant.
It's a marketing. Now it's a marketing scheme.
Yeah, totally. It's really getting into the mainstream of people knowing that there is something called antioxidant.
Now with Epstein Barr, I just want to back up really quick because that's a common thing that can be thrown out in terms of these interviews and talking with experts. They'll say Epstein Barr virus can lead to, a multitude of symptoms, a multitude of conditions. Is that a virus that you contract at some point in life and then goes dormant? Or is that something that's constantly going on in the background, helping to express these symptoms? Can you dive into what Epstein Barr virus is and why it's so impactful?
For sure. So Epstein Barr virus is basically a human herpes virus 4, and it causes infectious mononucleosis. And it's even been linked to many cancers, especially lymphomas. So basically what happens is that when you're younger and you contract the Epstein Barr virus, it's also called the kissing disease. There is a chance that you get over it and you're fine and you never have a problem again. But then there is chance that sometimes it can stay in the body chronically, like for a long time, and it doesn't get completely eradicated from the body. So then what happens? Yeah. So then what happens is that you're okay for as long as you're okay. But then when you get into any kind of stressful situation, whether it's emotional or it's physical or mental or whatever, then there could be, because of the suppressed immune system, your Epstein Barr virus can start replicating, or what is called reactivation. So you can get into reactivation at any time. And that's what would basically cause your fatigue, your chronic fatigue, to linger on and not go away.
Okay.
So it's very, very common. So we check all the antibodies. There are various different antibodies that you could check with the Epstein Barr, and some of them are related to the reactivation. But in general, what I've seen is that there is, when the antibody levels, the titers or the levels of the antibodies are very high, it usually correlates, and the patient is complaining of severe fatigue, then it correlates very well. And if you focus on your treatments with the virus, then you can help the patient overcome this uphill battle that they have been battling for a long time.
So a patient walks in, they're tired, they're fatigued, their symptoms are expressing in multiple different ways. They test for high titers for Epstein Barr. You do some diet, some nutrition testing, realize that they might have a gluten allergy or a dairy allergy. Is that your starting point as far as what testing looks like and then treatment? Or do you have a wider panel that you use to assess these people?
Oh, yes, for sure. I mean, these are just the parts of it. But yes, I do check for food sensitivity or food allergy testing. We check for not only Epstein Barr, we have actually a whole panel for viruses that we check, which are very common related to the chronic fatigue syndrome. Like you have mycoplasma, you have cytomegalovirus or human herpes virus 6, and parvovirus. All these different viruses are also connected with chronic fatigue syndrome. So we check, I have created a chronic viral panel, which we check for patients who present with mainly the symptom of fatigue. But there is a lot more things we're testing. If the patient is, let's say, over 35 years old, then we also check them for hormonal deficiencies or imbalances. So, from all the female hormones or sex hormones down to thyroid hormone and to the adrenals and the pituitary gland. So we check the whole endocrine axis.
Is 35 the age where hormones start going a little off?
Yeah,
start getting a little wild.
Okay. For sure. It's interesting now. I see younger and younger patients coming in for hormone balancing.
Why do you think that is?
It's interesting. I think personally, from seeing so many patients, I think that the reason people are getting older faster these days is because of the environmental toxicity. I don't think it's their fault that they're eating all this bad food or the fast foods and, not drinking clean water and being under a lot of stress. But I think it's a lot of environmental toxicity that is causing lots of human ailments and diseases. I mean, a lot. So we test patients for also toxicity and finding out what their livers are doing. So I personally feel there's a lot of liver overload on patients. I mean, even like I get, male patients, 35 years old, even 32 years old. Recently, I've been treating people like 31, 32-year-old male patients who are coming with not enough energy or other symptoms, sexual dysfunction or whatever. And we check their livers, and there you are. They're not doing well. And then their testosterone levels falls because the liver is not able to do its job properly, or
because the liver is a huge detoxifier, right?
Yeah.
Our liver helps us with our body burden of our toxic load to detox and help us run in balance.
For sure. I think liver is one of the major organs that need to be really cleaned up and make sure that they are actually working very, very well. And I tell you, one of the first things that I do with patients who are chronically fatigued is the liver detox.
I like that. Now you kind of walked into one of my questions. Is this a male or a female dominated syndrome, or is it pretty split?
Well, it's traditionally or conventionally, it has been called as a woman-dominated diagnosis. Most women complain of it. But according to the NIH, it looks like there is also 35 to 40% men that will complain of fatigue.
Okay.
So I get a lot of males as well. It's not only a women's disease, but I think women are more aware of their physical condition than men are. I shouldn't be so direct on this, but I think I see more men not complaining about their body conditions. So first we get the women, and a lot of times the women drag in their husbands because they know the husbands need more energy because they need to do the house chores, or whatever. So they bring in their husbands. So we treat their husbands as well. And so I think it's mainly women only because women are more aware of what's happening and they will be more liable to complain to their physicians about their not enough energy.
So someone comes in, they walk through your doors, you do a huge panel, you start really coming to conclusions of why they might have this chronic fatigue. And we start putting in nutrients, taking out nutrients, right? Going through the elimination phase, also treating the virus load that might be in their body. What does that look like? So what tools are you now bringing to get people to balance and to heal them from chronic fatigue syndrome?
Yeah, actually, that's one of the things that I love helping patients with. And the one of the major treatments that we use is what's called IV treatments, which are intravenous treatments. And the reason that we do that is twofold. One is that when you do oral treatments, because most of these, like remember I said, most of these patients have seen other doctors.
Yeah.
And even though they have seen other doctors, they have seen other alternative doctors, but they're not getting better. So I realized early on in my career was that one of the things that I need to do is to bypass the gut. Because like you said earlier, was the gut is a big issue, right? So in order for me to bypass a gut and get the results quickly, I have to do the intravenous treatments. And there is lots of IV treatments that are available. One of my favorite, actually all of them are my favorite. We do mega doses of vitamin C. We do UBI, which is amazing treatment, amazing treatment.
And for the listeners out there, UBI is ultraviolet blood irradiation. We have an episode on it early in our show. Highly recommend going to listen to that to understand kind of like the science and the depths behind what UBI is.
Oh, thank you, Jessica, for that. So UBI is my favorite. So somebody who is chronically fatigued has been fighting with let's say this Epstein Barr virus. Then the UBI, what it does is that since it's light energy, it basically revs up or gives the energy or makes the white blood cells of the body energized. So then they are able to handle or fight with the virus internally. So you are basically what you're doing with the IV treatments is you're boosting up the immune system. So the immune system can actually fight with the virus. And so that you don't have to pay the price with the fatigue and no energy. So I love UBIs. Patients with the chronic infections respond very, very well to UBI. Another treatment that I have is called ozone treatment. And it's a medical ozone, amazing treatment, causes ozonides to go through the body and makes the body produce antioxidants and also improves the anti-inflammation branch of the immune system. So that is amazing, and it deals very well with the viruses. So the viruses they stop replicating. So the reactivation of the virus goes away and the virus goes dormant. So then the body is more like in control. So like you said there, you are in valence. You have your body system in more harmony, and then they are able to produce the energy because nothing is stopping them from creating the energy.
What's really cool about the tools that you just laid out and how you talk through that was we really like to say the body is designed to heal. Our bodies are designed to be in balance. Our systems are designed to work together. And so how you stated that was we want to support the body to then become into balance and start actually kicking this virus to the curb and learning how the systems now can work together to process the nutrients to give you the energy, right? It's just finding the tools that can support your body doing what it's supposed to do, which is heal and then run perfectly.
Exactly right.
Does it always work that way though? I mean, I painted such a pretty picture, and I know there's someone out there just being like, yeah, right. I've been chronically fatigued for 20 years. You're telling me a couple of UBI or ozone or vitamin C IV treatments are going to just bring me back to life? Does it always work that well? Speak to the skeptic who's just in the thick of this right now.
Oh, for sure. For sure. Actually, the funny thing is that I'm going to share this success story right now. This patient is actually, she's only 27 years old. And when she came in, She told me she was very highly skeptical that she was in a functional medicine doctor's office. However, she said, I genuinely feel I'm going to die. Please help me. And her history was she had a 3-year history of severe fatigue, and she had low grade fever, night sweats, and she was sleeping 16 to 20 hours a day because she had no energy to get up from her bed.
That right there is like when you said earlier, the housewife or the woman who's at home who can't do the dishes. It's just like the right 16 to
Yeah.
20 hours a day.
Yeah.
It's hard to even fathom and still not feeling rested.
Exactly. So her mother and her were there together. And she told me that she was sick for 3 years. Before she got sick, she was traveling, riding horses, going to school. She had a great social life. And she was a general manager for a restaurant. And then after, I think she was on a vacation, and she came back from vacation. She was completely on the bed. And in the last 3 years prior to her consulting with me, she had seen many other doctors, including infectious disease doctor. And they had tested her and done many tests to rule out any kind of bacterial diseases or any kind of zoonotic diseases. She has seen gastrointestinal, endocrine specialists, psychiatrists, even neurologists, cardiologists. I mean, you name it. She had seen every specialty specialist. And then she wasn't getting anywhere. She was actually was in disability when she saw me. Because she couldn't work. So she was on disability for, I think, for a while before she came to see me.
Which is a common thread too, correct?
Yeah.
You're so tired that you lose your employment.
Yeah, exactly. The biggest thing. So my whole idea about being a functional medicine doctor is to get, so my product for every patient is this. I want my patient to be able to do what they are passionate about in their lives.
Yeah.
Yeah. And with nothing stopping them from doing it.
Yeah.
So that's the product I want. And not only that, the other part of the product is I want my patients to be educated into knowing how to take care of the bodies. Because we weren't born with a manual when at time of birth, we weren't given here's the body manual. This is how you keep this body going, right?
Well, and you find without the education piece, there's probably a higher relapse into the chronic condition.
Yes, absolutely.
So this patient comes to you. She's like, I don't necessarily trust you. I've been exhausted for years. I don't have my job. I'm young enough. I'm 27 to where I should have a lot of vitality, but I don't really think you can help me. But here, try.
Exactly. But she was like, please do whatever you can to help me, even though I don't really believe what you're gonna do is gonna work, but I want to try it. I want to do everything you're gonna ask me to do. So anyway, we tested her. She for sure she had allergies, food allergies. She had dairy allergy, wheat, gluten, oats, coffee, sesame seeds. You can name it. There were so many things that she didn't even realize that she was allergic to, and she was eating them every day. So, and then we found out that she also had Epstein Barr Virus, very high levels of it. And so we started treating her. And remember that the patients who go to the conventional doctors for chronic fatigue and the doctor doesn't find anything, usually prescribe them antidepressants, because they tell you get told that it's all in your mind and it's all in your head. So you are just depressed, and this is why you feel sick and tired and not wanting to do anything. So she was actually on an antidepressant Zoloft for almost a year. She was trying everything. So she tried Zoloft. She said, doesn't work. I still feel the same. So anyway, so our job is not only to get the patients well, but we also want to get them off the drugs, because these drugs are very severe. There are severe side effects of some of these drugs, and they are mind altering and very powerful drugs. So we want to get the patient off the drug. So I think it took us about a couple of months, and we started doing her UBI, started giving her mega dose of vitamin C drips, and a few other things, told her what to eat. And then she comes back and she tells me this. And she said that she feels, she says she's doing good, Oh, the other thing was her problem was that she was losing a lot of weight because she wasn't able to eat, and it was just terrible, right? She was become so skinny. She was so skinny, like a little stick. And so she said she gained 20 pounds back. I think she had lost about 30 pounds or something. And so she gained the 20 pounds back and she feels great and she's excited and happy. She said very clearly that I didn't believe in the beginning. And actually, she even ended me calling a witch doctor. She told me that I couldn't believe it. So when the first time she got the UBI, she came out really happy. And she says, "What is this? Is it a voodoo medicine?"
She
So,
finally gets well and then thinks it's a witch doctor, right? That is
yeah,
funny.
it was amazing. And she told me that in the end, she told me she was fantastic and she was walking 5 miles a day, started a new business. And she was doing great. And I think she was taking care of 14 dogs as a business. And she had gained her weight back. Her cycles were regular. I mean, she had a lot more energy. She was living her normal life, in other
Her
words.
body went back to balance.
Yes, the balance. And then she also stopped the Zoloft. And the brain fog went away. See? So it's interesting how these things work out.
It is interesting looking at, again, energy output versus energy input, and then where that miss is, where our body is out of balance. And then bringing that into alignment can create a different, I mean, she got her life back.
She got her life back. She was very, very grateful.
And so after hearing, I mean, I know you've treated this for years, but after hearing your own personal story and then this story of this 27-year-old girl, do you have hope? I mean, there's people out there listening who just don't feel hope. Should they have hope to get their life back?
Oh, for sure. I think one for one, very common thread with my patients is in the end, they tell me, "You are my last hope."
Yeah. Yeah. So now you're in California. Not everyone listening is in California.
Yes.
I just want to talk to those of you out there. You can email us at info@thehealingreset.com if you're struggling with chronic fatigue syndrome or just super fatigued and it hasn't yet been diagnosed, truly diagnosed. There are people like Dr. Mathur who can really address these underlying issues and help bring your body back into balance. So you're not in this alone. You're not fighting this alone. But Dr. Mathur, just to step outside of chronic fatigue syndrome and talk about everyday health, we like to end this podcast by telling the listeners 3 things that they can implement today for better health. So when you see all of your patients, what are 3 common threads? You just say A, B, and C will help you today move forward with better body balance.
Oh, for sure. I think the basic foundation of a body, because if you look at the body as a machine, which it is, right? The body is actually a machine, believe it or not. It is like having a car. So you have to tune it up every so often and you have to give it the right fuel, right? The car is going to work just fine. So I think the basics is first, like I said, foundation is food. So first find out what is the right foods for you. Very important. And the system that we use is called metabolic typing. And I'm sure you can find practitioners doing metabolic typing. We actually have a new app coming out. Anyway, so there is a metabolic typing. So you find out what is the right foods for you. Is it the plant-based or is it the Mediterranean or is it the ketogenic diet or is it the whatever, right? All kinds of diet are out there. And it was very confusing because people don't know, okay, one person or one expert says, oh, the plant-based is the best diet you can do, right? And then the other expert says, no, it's a paleo diet. So I know there's a lot of confusion in nutrition. And so I want to tell everyone that find out what your metabolic type is. So you can give the right fuel to your body, right? So you can have a Mercedes, but if you don't give it the right fuel, it's not going to run. Or if you're a Toyota, you have to give it the right fuel for it to run well. And same way, the bodies need to be run well with the correct fuel. So that's number 1 suggestion. The number 2 suggestion is for sure. So even if you eat whatever you're eating, make sure it is organic. Make sure it is organic. Very important, because if you put toxins in your body more, then you can't imagine getting well. So you have to make sure that you're not putting more toxicity in. So you already have some, right? This is why you're maybe not feeling your best. So if you don't add to it by eating conventionally grown food, with all the pesticides, the herbicides, and the animal hormones and whatnot that are given to this animals, or the vegetables that are grown out of the soil that have been completely sprayed with herbicides and pesticides, right? So that's my first thing that I would say that, or second thing, to make sure you eat organic. And the third is in terms of exercise, of course, is very important, right? Exercise, but if you're so fatigued that you can't exercise, obviously, I tell my patients not to exercise until they feel they have the energy to exercise. But if you don't have the fatigue, it's just a general way to prevent disease, then exercise at least 20 minutes a day is imperative. I mean, you cannot have a good health because body, life is motion, right? If you don't move the body, there is no life, right? Have you seen the dead body moving?
I love that. No, I haven't.
Exactly. So you have to move the body in order for you to live your life. So exercise is very important, absolutely important. And if you want a couple of extra things, I would say take vitamin D, because vitamin D is so much research in recent years has shown that it actually lowers the morbidity and mortality rate from any cause and all cause, any cause. So I give an example to my patient, like two people are walking across the street and they get hit by a big truck. Then the one who's going to survive, guess who? Is the one who has the optimum levels of vitamin D in their body. So, moral of the story,
take vitamin D.
Yeah. Take vitamin D and get it tested so you know you are at the optimal levels. Because if you are in the normal levels, you still may not be protected because it's too low. The range is, let's say, 3,200, and the optimum is between 60 and 80. It's just a number, but you need to make sure that it is optimum. And obviously, you can check with your physician and consult with them and get the blood test. So I think those are the easiest way to keep yourself healthy and prevent any kind of major disease.
Well, thank you so much for spending time with us today, Dr. Mathur. We just appreciate your wisdom and your hope that goes behind, us healing from these severe chronic conditions. And we look forward to next time that we chat. Thank you so much.
Well, thank you so much, Jessica, for having me here today.